I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. Mental health has become a widespread crisis, and our region is no exception. This is a large and complex issue. Quality mental health care is a critical part of the solution. In recent years, ThedaCare has made great strides in offering more ways to connect to behavioral health care. Today, we're giving you an exclusive look at a new clinic that brings close-to-home care to our rural communities. ThedaCare Behavioral Health-Waupaca is set to open this summer. Our first guest today is Julie Meyer, Director of ThedaCare Behavioral Health. Julie, thanks for being with us.
Of course, thanks for having me.
So in the latest ThedaCare Community Needs Health Assessment, it was identified that mental health needs is the greatest need out of all of our communities that we serve. So what kind of demand are you seeing when it comes to mental health?
The demand for mental health and substance use disorder treatment is extravagant. We're doing all we can to keep up with the need. So we're coming up with innovative ways to meet that demand. I will say it's not just about the need, but also in a reduction in stigma that came from all the efforts during COVID to outreach and create awareness around mental health. So it's a good thing as well because it means that people are accessing the care that they need.
Oh, that is important to note there. And over the last couple of years, ThedaCare has really done a lot of different things to help with the demand. What are some of those things that we've done?
Yeah, about 2 years ago, we opened the Behavioral Health Walk-In Clinic in Neenah. This is a really innovative approach to offering same-day services to a variety of behavioral health professionals. So patients can walk in, see a psychiatrist, mental health therapist, or a substance use disorder counselor, receive an evaluation, get started on the right track towards treatment, or just talk to someone when they need to. We've also expanded collaborative care, which is an evidence-based practice where we put a behavioral health practitioner right into primary care. So you can see a behavioral health practitioner when you go for your wellness visit, and that collaboration manager can work with you for months to help you get the access to medication that you might need. We are also opening a brand new clinic in Waupaca, which is going to serve as our Western hub to really enhance access for the Western portion of our footprint.
So we know that mental health is a huge issue for kids and teens. Can you talk about the resources that are available out there for them?
Yeah. ThedaCare has a great partner in Catalpa Health who serves our pediatric and adolescent community in the Fox Valley and beyond. Also, I just want to say starting with your kid's pediatrician is a great way to get connected to Catalpa and other resources in the community. It's never too early to have that first conversation. And if you have any inkling, go ahead and start that conversation.
Yeah, important first steps to take there.
Yes.
So speaking of first steps, we do know that it's kind of difficult to begin those conversations when it comes to mental health needs. So do you have any advice for us how to start those conversations?
Yeah, it's important, and it can be scary to have that first conversation, but it's important that we don't sweep it under the rug. So as I mentioned, the pediatrician or those teachers or just a trusted friend is a great place to bring it up. Reference behaviors, ask questions, but again, the longer we wait, the longer it will take for your kid to get the interventions that they need.
And for adults, I think it's maybe even more difficult to have those conversations, especially when you're speaking inward about yourself. What do you recommend to begin that process?
Yeah. Finding someone you trust. Again, we've made such strides as a community to reduce stigma around mental health. I think being vulnerable so that you can start to make strides towards living your best life is so important. So find that person that you trust and start there and know that your best interests will be at heart.
Perfect. Julie, thank you for being with us. You're joining us again in just a little bit for one more segment, so we'll see you soon.
Thank you.
Joining us next to talk more about our new clinic in Waupaca is Kellie Diedrick, Vice President of Critical Access Hospitals for ThedaCare. Kellie, welcome and thanks for being with us.
Thanks for having me.
Kellie, our first question is why Waupaca and who will this new clinic serve?
So we have a very robust behavioral health program across our ThedaCare footprint. When we looked at the gaps, Western Wisconsin was an opportunity for us, the western side of the footprint that we serve. So we looked at Waupaca County because we have 2 hospitals, New London and Waupaca. So we can serve not only them, but other rural communities that have to travel so far to get the services they may need.
And that's important too, because when it comes to just access and transportation, there may be barriers.
Absolutely. In the rural communities, we lack access to routine transportation. So when we look at other needs besides healthcare needs, transportation is a major opportunity for us in the rural communities. So we knew that telemedicine does meet some needs, but the idea of building a facility in which we can put mental health therapists and physically serve the population was really important at ThedaCare.
It's really breaking down those barriers, right?
Absolutely, yes.
Okay. Tell us a little bit about the funding for the project.
Yeah, so that's really interesting. And, we're very fortunate to have such an involved community. So years ago, many members of our community donated dollars to a foundation that would allow us to have sustainable healthcare needs met in Waupaca County moving forward. So we looked at that pool of money that we had, and we decided we wanted to spend it on the community. So we're utilizing community dollars to build a community-based mental health center like this. So it's going to benefit those in the community by those in the community. So
that's a neat story, staying right here locally.
Absolutely.
And providing access to the care that's needed.
Yeah, this community is really committed to healthcare. They're committed to the hospital, to the clinic, to the services we provide. So being able to use those dollars to provide something back to the community to show how much we care really means a lot.
So this new clinic will increase the number of providers in this area. Why is that so important?
Mental health therapy providers are really hard to come by. So oftentimes in rural communities, we use telemedicine in order to connect patients with providers. So the building itself, I think, was really critical because then we can fill it with those mental health providers. Now, we likely will have some telemedicine services, of course, but being able to have the physical footprint to be able to expand and meet the demand was important to us.
All right, Kellie, this has been great information. Thank you for being with us.
Well, thank you.
As we've learned, connecting to mental health care often begins with a conversation with a primary care provider. Here to tell us more about that is Dr. Robert Sedlacek, a family medicine physician with ThedaCare Physicians Waupaca. Thanks so much for being with us.
Thank you. It's a pleasure to be here.
So our very first question here, can you just explain what you're seeing when it comes to mental health care?
Last year, 21% of adults reported some form of mental health issue. 5% of those were severe mental health issues. That's around 50 million Americans who had some kind of mental health issue. When it comes to kids, we're seeing about 16% of adolescents reporting a major depressive episode in the last year. Unfortunately, for both adults and kids, there's not as good access as we'd like to see.
So as a primary care provider, how do you help people and how do you assess their mental health?
Frankly, it just starts with asking. In the clinic, we are routinely screening adults for anxiety and depression. We also have a set of tools for screening for substance use, which so often coincides with mental health issues. Opening that conversation can be challenging, but the screening tools do a good job of sort of alerting us to patients who are maybe struggling or having troubles, and then drilling down a little bit into that, trying to sort out what is this that they're experiencing.
What's the connection between someone's mental health and their physical health?
To put it simply, the brain is an organ of the body. The mind is an output of our brain. If there is physical illness, then the mental illness tends to follow, and vice versa. If there is a disturbance in the psyche, in the mind, then we often see physical symptoms that follow, and it's usually that physical symptom that gets someone to come in. I very rarely have a patient who comes in saying, I think I'm depressed. But oftentimes they'll come in and say, my stomach hurts and I'm not sure why. Or I'm feeling kind of foggy or cloudy and can't quite focus. Or I'm having trouble sleeping or eating.
So all those things are connected.
Absolutely.
Okay. So as people go throughout their lives, there are different times that can increase a person's risk for maybe experiencing a mental health challenge. Can you explain what those times might be?
This can happen in any number of factors. A financial crisis that someone experiences, a transition like a change in job. It doesn't always have to be unhappy events. Someone could have gotten a promotion and find there's new stressors at work. They could have had the birth of a child, a change in the nature of their relationship or the relationships around them. All of those may lead to a mental health issue.
Okay. So when it comes to our mental health, what are some steps that maybe you recommend for improving our mental health or our coping skills?
I offer to you that I think of the mindfulness side of things in the same way that I think of recommending physical exercise for patients. As we exercise our body, we also should be exercising our mind. And there's a whole range of ways you can do that, from things like mindfulness meditation or journaling, and then interpersonal interactions. And those also run the gamut from maintaining healthy friendships and seeking out social interactions, clubs and groups and hobbies that we develop, to more formal settings where we may seek out a counselor to help us understand why we think the way we think or why a particular problem seems to keep coming up.
Okay, those all seem like little things that maybe we can all do and work toward to improve our mental health.
Absolutely.
All right, Dr. Sedlacek, thanks so much for being with us today. We appreciate it.
It's my pleasure.
Often a loved one is experiencing a mental health challenge, and it can be tricky to know what to say or how to help. Julie Meyer is back with us. She's the director of ThedaCare Behavioral Health. And Julie, today we're going to ask you to maybe react to some scenarios, explain if that's the right way or wrong way to react in that situation. All right, let's take a look at the first one.
I noticed you seem down lately. I know a guy who knows a guy who took a psychology class in college, if you're interested.
Okay, so what's your reaction to that if somebody is coming up with that?
I appreciate that they asked the question, right? Being there is so important and really 99% of it. But we have trained behavioral health professionals that we can connect individuals with. And I would always recommend going through your primary care provider to getting connected with the right behavioral health provider.
All right, let's listen to the next one.
Did you switch your coffee to decaf this morning? Because you seem a little off.
Well, coffee is really important to all of our routines. I do understand that. However, relying or talking through using any sort of substances about our behaviors, especially when you're not a professional, wouldn't be my advice. But I would also add that if someone you love is seeming down or not acting like they usually act, or maybe not quite as happy as they usually are, they might be experiencing some depression. And I think recommending that they talk to a provider or professional would be the right approach there.
I wore my spandex today because I'm your superhero. How can I help you today?
You know, actually, I think that's a great lighthearted approach to start a conversation, but also realizing that you probably can't solve all of a person's problems is important. But I think showing that you're showing up is really important, and a little humor can't hurt some hard conversations.
I know life gets busy, but I've noticed that you've missed the last couple of book clubs. Is everything okay?
That's great. I mean, this person noticed some changes in behavior, realized that their friend was withdrawing a little bit, and wanted to check in. And that's really the right thing to do. And I really applaud that person.
Okay, so a lot of these that we listened to were very funny, right? And like you said, does humor go a long way here at times?
It can, but I think we have to be careful how far we go with that humor, make sure we're not poking fun at the person's situation or what they're dealing with, right? We only can see surface level and there can be a lot going on. But I mean, using a little humor to start the conversation when it's appropriate and done in an appropriate way is a great way to get that conversation started. But I would just recommend asking the questions, being open to having the conversation, and recommending a path forward. You don't have to know all the answers to be a compassionate friend.
Good advice, Julie. Thank you so much for being with us.
Of course. Thank you for having me.
And if you have a mental health concern, please talk with your primary care provider to get connected to referrals and resources. Thanks for watching. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.